A new report from the Illinois Department of Children and Family Services Inspector General says more kids are dying despite involvement from the state's Child Welfare Agency. It's an issue WGN Investigates has been reporting on for several years now. Joining us now to talk about some of the findings is Cook County Public Guardian Charles Goldberg. Thanks for being with us.
Hi, good evening.
All right, let's start with that finding of 171 children died in the past year despite being in DCFS being involved in their lives. That's the highest number in 20 years. Why do you think that's happening?
Yeah, it's mind-boggling, and it's largely they have a critical shortage of investigators. In fact, they've been under a court order for years to improve their investigator caseload ratio, and DCFS has been out of compliance with that court order for years. I mean, it's just common sense. When investigators labor under untenable, absurdly high caseloads, they're not going to be able to do the work.
So DCFS points out that 105 of the 171 deaths were accidents or natural causes. And I was actually surprised to read in the IG's report that the second leading cause of death for a child under DCFS's watch was a gunshot wound. How can the Child Welfare Agency be expected to prevent that?
Yeah, gun violence among our youth is a huge problem. So the 171 children who died on DCFS's watch, it includes all categories of abuse. It includes kids who were abused and killed by their parents while DCFS was investigating the case or providing services. It includes children who were killed in foster care. It includes random gun violence. It includes the whole gamut. But it is a piece of the puzzle of how DCFS is doing. And the number continues to get worse and worse every year. And 171 children, it's up more than 40% from last year when the number was 122 children. And as you mentioned, it's the highest number in at least 2 decades, more than 2 decades.
I want to ask you about specifically about a case that we've covered extensively, and that's the murder of 8-year-old Amaria Osby in Uptown last summer. DCFS was contacted after a violent fight between her parents, who were allegedly using PCP. The Inspector General confirmed some of our previous reporting that said DCFS made no attempt to visit Amaria to check on her for 2 months. Then a new case investigator was assigned, and that person visited Amaria the day before she was murdered and actually said that she was safe in her home. And it was hours later, of course, that police say her mom confessed to suffocating her while high. How does that happen? I mean, you have a DCFS worker in the house. Amaria told the DCFS worker, "I feel safe," and still, you know, she was murdered.
Well, this was a case that cried out for, at a minimum, DCFS monitoring and drug treatment for the mother. And services for the family at a minimum. This was not DCFS's first involvement with the family. And in fact, the prior involvement also involved allegations of drug use. And this report involved allegations of drug use and domestic violence, a big fight in front of the child. And DCFS is required by law to see the child and to talk to the family within 1 day of a report of abuse. And if they're not successful in doing so, they have to continue trying each and every day, including weekends, including holidays, until they're successful in doing so. And DCFS's regs specifically say that if you're not successful in seeing the child at the home, you have to try other places like school, like daycare, like other family members. And DCFS did not do anything in this case for 2 months, and then they're in the home, and the next day the child died.
It was a tragedy.
And this is the mother admitted taking PCP before she killed Amaria. This was really a case you have to wonder if DCFS was actively involved with this family during that entire 2 months, that they knew of this child, that they knew of Amaria. It seems clear they would have known that this mother needed drug treatment, supervision of the family, services.
Yeah, but there was that 2-month gap there. We've got to run, but I do want to say big picture. DCFS released a statement about the Inspector General's report that says the report covers more than 425,000 children reached by the department through its work, which is 55% more than a decade ago. So their caseloads have gone up big time. Charles Goldberg is the Cook County Public Guardian. We appreciate your time and your work on this issue.
Thanks, Ben.
Thank you.